Hi, this video is the art of hair transplant restoration surgery on a client who's a class 5-6 hair loss pattern. He's really falling from the front all the way toward the back. He has a few residual vellus hair, which is on the way up. Our goal is to do at least 4,500 grafts or more. Focus heavily in the front half first, and then whatever remaining hair we scatter to the back. So the front will eat up around 2,500 to 3,000 grafts, depending on how thick your hair is, depending on how big the head is. The bigger the head, the more surface area to cover. As you know, I'm one of the very few surgeons who specialize in restoring an advanced hair loss pattern like 5, 6, 7 hair loss pattern. With advanced hair loss pattern, the strip method is more effective because you can harvest more graft. You get it more done today, and you reach your goal faster. Versus the FUE is more for mild to moderate hair loss. For this client here, he opted the strip method. Why? Because he wants to harvest as much as we can. As much as we can today. Now you can still do the FUE. You just need multiple sessions. Even with the strip method, because such an advanced hair loss, you're going to need more than one surgery to have perfect coverage. But some people with that one surgery is enough. But versus the FUE, you're going to need at least 2 or 3, because the FUE is going to be $2,500 to $3,000 front. A year later, we do the back half. Hair transplant is an art form. It's not just dependent on the surgical skill of the surgeon, but it also requires the artistic and aesthetic detail to ensure a very natural result. From the mid-eyebrow to the hairline for a Caucasian, around 7.5 to 8.5 centimeter. For Asian and Black, around 6.5 to 7. And other ethnic varies in between. Now, we use the average height of the hairline as a guide, but when we build the hairline, we build it according to each individual facial structure. It's more of a custom hairline, because your hair facial structure is different from your brother and your father. So you want the surgeon make sure that the hairline is built according to your facial structure. As overall is proportional to the overall face is a third. Mid-eyebrow to the hairline is a third. Mid-glabella is tip of the nose a third. Tip of the nose and bottom chin is a third. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. No hairline is straight, so we zigzag too. Straight curved hairline look too artificial, and it will attract because it will attract attention. And then once we get the shape down, we transplant precisely. Start at 35, 45 at the front. Increases when you go backward. Changes when you go different direction. We transplant rows and rows of single hair graft in the front, followed by root with 2 hair, 3 hair, 4 hair in the back for bulk and volume. So the goal in the front is for softness and naturalness. The goal in the back for volume and density. That's why we select larger group. I'm excited for this client because in a year's time he will be completely looks different. Will be transformed with a full set of hair and a lower hairline. Really might create the hairline. Not just having hair that's not good enough, but having hair that's natural for you. That is mature hairline, as if you have no hair loss. What is the most highest and natural hairline you should have? You shouldn't have hairline all the way up there. In your time, he'll be really transformed. He'll look younger and gaining 10 to 20 years of his youth back. And not only that, but he framed the face and really enhanced all the feature on the face, his eyes and nose and all this. So this is the art of hair transplant restoration surgery on a client with a class 5-6 hair loss pattern. Thank you.